Welcome back, everyone. Well, this is not breaking news that healthcare issues in this country very complicated and very controversial. Sometimes you think to yourself, boy, isn't it just common sense? Well, unfortunately, common sense doesn't really reign supreme here because in the list of developing countries in the world, the United States, if it isn't last, it's close to last in providing fundamental care for the people that live in this country. And with all of the debate about the Affordable Care Act and what's going to replace it, and should it be repealed, should it be reformed, revised, and whatever, it just seems that we get stuck in the weeds constantly. Well, we became aware of a group right here in our community, Saratoga Health Committee, who are trying desperately to help us sort through the questions surrounding this issue. And joining me today is Sergia Coffey.
Hello.
Welcome, Sergia. Very nice to have you here.
Thank you.
And George Jolly. Welcome, George. They're both members of the Saratoga Health Committee, and they're really trying to work their way through all of the particular issues that are either come up, that there are questions about, or that there's arguments about, controversy, surrounding some of these things. I'm going to ask you, Sergia,
Sure.
Tell me about what the mission is of the Saratoga Health Committee.
So the Saratoga Health Committee has been is trying to help get single payer in New York State and federally too, but our focus is on the New York State Health Act, which has passed legislation 3 times and is one New York State Senator short of passing. It was put forward by Gottfried and in the Assembly, and it would basically work as Medicare for all. So rather than 20 to 30 cents of every health care dollar going to the cost of dealing with insurance companies, 2 cents of every dollar would go directly to the medical providers. It would be no deductibles. It would be no copays. It would be no premiums. 98% of the people would be paying less than they're currently paying for the health insurance. And it would be a graduated progressive tax that would be paid. In addition to that, the towns, counties, school districts, and New York State would save millions of dollars in their costs of providing health care for their employees.
Okay. George, the single-payer health care. As soon as you hear that, I know, I can hear it out there already. A lot of people going, yes, Bernie Sanders, and the other half of the audience is going, oh no, socialism. But there's a lot to talk about when it comes to single payer. Isn't that true?
The first thing is that single payer, we're talking about government finance. We're not talking about government health delivery. Under the various single payer plans that have been proposed, health care would be continued to be provided by private providers in offices, hospitals, clinics, where they would be provided by private, where the government would only handle the payment system, so that it's not socialized medicine in England is truly socialized, where the government owns the clinics, pays the doctors who are employees, and we're not talking about a system like that here. We're talking about privately delivered medical care that's publicly financed.
You know what? I think that is an incredibly important distinction. And I've heard arguments on both sides of the fence about the healthcare system in Great Britain. I have friends that live in England. And socialized medicine is not what this is. And I know a lot of times people rush to that. As soon as they hear single payer, oh, the government, oh my God, another bureaucracy, oh no, another big mess. The way this is set up is that the government pays the bills. So in other words, then negotiation for medicine, all of the major decisions that are made regarding the health care, not only that, but also really the underlying theme here is that healthcare is a human right. It should be a human right in this country. So explain to me just a little bit, George, about how does this work?
The New York Health Act would create a New York Health trust fund, a big pool of money into which all monies would go that are going to pay for health care. The fund would be responsible for paying for all necessary medical care, including medical, dental,
right, sure.
and vision care, medicines,
Hospital.
Hospital care, the doctor's offices. That pool would be fed first by federal monies, which is already responsible, paying for about 2/3 of all health expenditure in our state. That would go, all the Medicare money would go into the pool, all the Medicaid money would go into the pool. And then in addition, there would be a payroll, there would be some taxes on earned income, payroll tax, and on unearned income.
Now, of course, the flag goes up as soon as you say taxes.
Right. But remember that those taxes are taking the place of the health insurance premiums that people are currently paying
To the insurance company.
to the insurance companies or through their employers, at work, or out of pocket that they're paying in terms of co-pays and deductibles. The result is what Sergia just said a moment ago. With this financing, 98% of New Yorkers will pay less than they do now. The difference, the increase in cost doesn't even occur until you get over incomes of 250 or
Now,
300,000.
Sergey, is it
Yeah.
true that in this proposal that the tax rate that an individual would pay is tiered depending on a certain criteria?
That's right. It depends on the amount of income you're actually earning. So the first $25,000 of income actually doesn't have any tax on it at all, and it increases as it goes up. So this is based on Gerald Friedman's analysis of how it would work. So in the end, 98% of the people would be paying a lot less than they are now. And they could actually have competition within the medical care. They could choose their doctors. They wouldn't have to be an in-network or out-of-network doctor. And that would actually decrease the inflation in the medical industry. So prices go up higher in the medical industry than they do in the rest of the economy because of the distortions by the insurance companies.
Companies, sure. Again, as an individual fighting this, it's one thing, but as a group, it's something else. We're just skimming the surface of this, so you're both invited back again. I would like to get into this at any time. And I hope this is posing some questions for you. You can go to a website, NYH Campaign, NYH, and then the word campaign.org. There's a ton of information there. Everything from how the New York Health Act works, who supports it, how close they are to actually getting this legislation passed in New York. California is another state where it's dangerously close. I have a feeling that it's like anything else in politics. People are apprehensive at first. The more you learn about it, the more you understand really what position you should take on it. And once one state adapts this, then you watch how it spreads. History repeating itself.
That's exactly how
as I like
it
to
happened
say.
in Canada.
Sure, of course. Our neighbors, by the way, have adopted this form of health care very successfully, by the way. Well, Sergia, thank you for coming in.
Thank you so
George,
much.
thanks for coming in.
Thank you.
And as I said, we're just starting to talk about this and willing to talk about it anytime you'd like to come in. And anybody else that would like to join the conversation, please go to our Facebook page and let us know what you think or if you'd like to participate. In the meantime, you can go to looktvonline.com to see this interview again.